Welcome to our second eBavet Academy video on tools for advising clients on medical problems. So by this stage you should have watched the first one that gives you information on the basics, and this is now for specific medical issues or complaints that clients may come in with their animals to give them the correct advice and to give them guidelines on what to do next. So once again, be sure to have a notepad or something nearby that you can jot down your questions, and you're welcome to direct those questions to the vet in your clinic, your mentor, or to me so that we can clear things up. Firstly, I'd like to highlight a little bit of legal information. So only vets may diagnose and recommend treatment for an animal. What that means is we've got to be very careful when advising a client in a front shop type of setup with the words that we choose. So we can't recommend things like, or we can't say things like it sounds like a food allergy, because there you're actually making a diagnosis. You can't say things like, let's treat it with this, because there you're making a diagnosis. So you've got to, and recommending a treatment. So you've got to be very careful with the words that you use. And this is what this presentation aims to help you with. So one can give them ideas of what it could be. It could be food allergies, it could be flea allergy, but the only person that could help you is a vet. So it's very important to make sure that we don't, as somebody working in a vet shop or a receptionist, that we don't give the impression that we're making a diagnosis or we are treating an animal. You are purely there to give advice and to direct them to a vet when necessary. And by the end of this presentation, you should have a clearer idea of when those times would be. Okay, so we're going to start off with the itchy animal. I think this is one of the things that we see most often in private practice, and it's probably one of the questions you're going to get the most. Having an itchy animal is incredibly frustrating for a client and frustrating for the pet as well. So it's important that we give them the right advice and we get them help quickly. Studies have shown that often clients will try 18 different things before they get to the vet. And that's quite heartbreaking that the poor animal has to go through all these 18 different things before getting to the vet, before getting a proper diagnosis and getting the proper treatment. So being on the front line in a vet shop, in reception, you can really make a difference for that animal by giving them the right advice at the right time. So first of all, let's just chat about causes. If you look at these three dogs here, you can see, or you can imagine that they're all itchy, they're sore, their skins are raw and red, and they're not happy chappies, but it's very difficult to just look at them like that and say what's wrong. You can't even as a vet just look at a picture of these dogs and say what the cause is. So it could be allergies, it could be other issues. This little puppy could have mange, this dog could have an autoimmune disease or hormonal problem, this dog could have a fungal infection or lots of other things as well. So as vets, we will never just make a diagnosis based on a photograph, especially of a skin disease. We'll always examine the pet. We need to look at the whole body, and we need to do specific tests as well. So we need to check for mites, we need to check for fungi, we need to check for bacteria, fleas. There's a whole long list that we go through when we diagnose what the problem is with itchy animals. So this is why it's really important to explain to the client that there are many causes, and it's very difficult just to tell. The skin can only do some certain things. It can only lose hair, it can only get red, it can only get crusty, regardless of what the cause is. So it's really, really important, if they have an itchy pet, for them to consult a vet earlier in the process rather than later. I'd also like to chat about diet trials. Excuse me. So many people have heard that pets can be allergic to food, and that's often the first thing they try and do, is change the food and see if that makes a difference. What they don't understand is that often the pets are not allergic to a specific brand of food, but they're allergic to an ingredient in the food, and that's where people make a big mistake. So they'll often say, okay, my dog is on Montego, for instance, and I'm going to change them over to Acana, and they're still itchy, so it can't be food. But what they don't realize is what was in the Montego is a similar ingredient to what's in the Acana. So diet trials can fail quite quickly if not done properly. And they need to really be done under the supervision of a vet. So it doesn't help just to change from one brand to another, or say maybe take away chicken, but they don't realize that the grain is the same in both the foods. So there's only two diets that can be used for diet trial, and that is the Hill's ZD and the Royal Canin Allergenic. And as you know, that both of these diets are prescription diets. So it's very important when somebody comes into your shop or into reception and saying, I want to try different food because my dog is itchy, don't give them the impression that this is a diet trial. Don't give them the impression that this is going to sort out their problem. It's very important to say to them a diet trial to 100% exclude food allergies needs to be done with a vet, and it's only prescription diets that can be given. So that's very important. And when we do diet trials as a vet, it's under very controlled circumstances. So it's for 6 to 8 weeks that we put that pet on either ZD or an allergenic, and we monitor them very carefully, and they may not get any other food. So it's very, very difficult to motivate the clients to do it correctly. And it's even more difficult to do that if they've already tried 3 or 4 different diets and they haven't worked. So it delays the process, and it makes it more difficult for us as vets to help the pet if you've changed the diet and said, what about this, what about that? So it's one of these times where it's not good to just try and make a sale of the food you've got in the shop. You rather want to send them to the vet for a properly controlled diet trial. And interestingly, only 10% of dogs have food allergies. So 1 in 10 dogs will respond on a diet trial. So it can be very frustrating because most of the dogs aren't going to get better on the diet. So very important not to give the person an impression that just changing the diet, changing the brand, changing the main ingredient will make a big difference. If they really want to exclude diet, they have to do it with the supervision of a vet. The other thing that we need to talk about is shampoos. So depending on what the skin issue is, we will choose a specific shampoo. So some dogs will need medicated shampoos, some will need soothing shampoos, some will need shampoos that break down the fatty layer. And it can be quite dangerous if you give the wrong shampoo in the wrong circumstance. So be cautious with shampoos, and I'll explain in a later slide what you can do safely, but don't just reach for the nearest shampoo on the shelf and say this will help. It is very specific. And the quickest, cheapest solution to get a cure or get a management plan for that pet is to send them to the vet. So this is really one of those times where you can make a huge difference for the animal. And I know that's why we're all in this profession, is we want to help the animal. So don't just reach behind you and grab something off the shelf and say, try this, try that. Don't do that. Rather say, you know what, there's so many things that it could be. There's so many things that are available for treatment. But get to one of our vets, get a diagnosis, get it sorted out, and then come back to us. We'll stock the product that they recommend, and then we'll help you and support you in that way. So this is just a little diagram showing you some of the causes, just highlighting all of those things. So here we've got allergens, things like dust mites, pollen, insecticides, mold. These things are in our environment, difficult to control. So these are things that can cause an allergic reaction in a dog. And fleas and mites. So mites cause mange. So those are things that can also make them itchy. Bacterial infections play a huge role in skin disease, and sometimes, especially nowadays, we get very highly resistant bacteria, so bacteria that don't just go away with the average antibiotic, and they can be quite tricky to treat. And then we have atopic dermatitis. So this is like eczema almost, and it's genetic, often very itchy dogs, quite difficult to control, and it makes them more likely to get other infections as well. So those are one of the things that could make your dog itchy. And fungal infections, so things like ringworm, can come on board as well, and then all your parasites, ticks and fleas. So this is just a quick slide of lots of different things that can cause the skin to look itchy, the skin to look red, and there's certain specific tests that we do to figure out exactly what it is, and in many cases there's more than one thing. So I know, sorry about that, a little went a bit haywire there. Let me quickly Okay, great. So what can you do? I've just now told you all the things that you can't do, so we don't want you giving too many things just to try. We really want you to get that person to take their pet to the vet. But there are situations where the person is adamant and they really want help right now, and you need to have tools to deal with that. So there are some things that you can do safely that may help the pet a little bit. So the first one is flea treatment. Many dogs are allergic to fleas, and many people don't control fleas in the environment very well. So I would definitely recommend that you chat to them about flea prevention. And the product of choice would be one of our newer generation products like your Provecto, NexGuard, Simparica, one of those products. And that's a great opportunity to chat to them about flea control and give them the right expectations. So if they do have a flea problem, it can take 3 to 6 months to get that under control. You can also recommend something like Dermafocus or Efazole, Miracoat, so your omega-3 products. That just helps build the fatty layer on the skin, and it helps with the health of the skin, and it may help with the itching. And then you can upgrade the diet. So I did chat earlier about diet trials and how we're not going to recommend a diet trial if you're not a vet. But what you can do is ask them about the diet, and if they are feeding something that you know is not a good quality diet, you can recommend an upgrade. So you can explain to them that that diet is not maybe fully balanced or hasn't got the best ingredients in it, and it may be worth trying a better quality diet. And just be careful with the words that you use. So we're not saying it's a diet trial. It's not to figure out if it's got an allergy. It's just to see if this better quality diet will make a difference for the dog's general health. With regards to shampoos, you can recommend something like Alamile or ProSoothe. So both of these are very soothing oatmeal-based shampoos, which may help in some cases. They're not medicated, so there's not really any contraindications or any reasons not to give it, so that would be a safe option. But always give them that disclaimer of, this may not be the right shampoo, you really need to get to the vet. And you need to reiterate that, as I've been doing over and over, you need to get to the vet, you need to get to the vet. And try and get them to go to the vet as early as possible. And then very importantly, don't change the vet's prescription. So if they come to you and they say, the vet put my dog on ZD, but it's too expensive, I want something else, be sure to explain to them that it's not wise to change the vet's prescription. Rather, chat to the vet and find out what their recommendation would be. Most of us vets understand things, and we really want to be there for the client and assist them to make the right choice, to make it easy for them. So if the person's struggling with what the vet told them to do, rather advise them to contact their vet and discuss it and see if there's another option before you just change it off the shelf. Okay, the other thing that a lot of people will come chat to you about is hotspots. So they'll see something on their pet, they'll go Google it, and they'll come back and say, I think my pet has a hotspot and I need something to sort it out. Firstly, we've got to be very careful about what we call confusers. So as I said earlier, the skin can only react in the same amount of ways regardless of what the cause is. So it can only lose its hair, it can only get red and itchy and oozy. Doesn't matter what causes it. So it's very easy to make the mistake of thinking that red spot is a hot spot. And just to highlight that, if you look at this dog over here, you can see there's a red raised spot there, and it might look like a hot spot, but it could be actually a tooth root abscess, which I think most likely. It could be a fungal infection. This one's not so clear, but the ears up here, although this does look very much like a hot spot, I suspect this dog has an ear infection and it's actually scratching at its ear, and that's why it's caused the hot spot. And with this dog, although it might look like a hot spot, this one I would be very worried about autoimmune skin disease or bleeding tendency or rat poison. So quite serious things that could cause the skin to look like that. So it's very dangerous to try and make a diagnosis just off a picture, especially if you don't have the knowledge of all the other hundreds of things that it could be. So once again, if that client comes in and they might bring their dog in, or they might bring a photo on their phone, always say to them, yes, it might be, but remember, the best thing to do if you're worried about something on your pet is get them to the vet. So please be aware of that. If they are convinced, their dog has had a hotspot before, it looks exactly the same as what it looked like the last time, then what I would recommend is an F10 disinfectant and F10 ointment. So this will cover most of the bacteria and fungi that could be present on the skin. It's not going to do any harm either. I would try and stay away from kind of home remedies for hotspots and things like that. And also give them kind of an expected time for it to get better. If it's not looking better in 1 or 2 days, then they really need to consult their vet. And even hotspots, which may not be life-threatening diseases like in this picture, they can spread very, very quickly. So they can start as a tiny little spot in the morning, and with the dog itching and scratching and biting at it, by the evening it can be this big. And then whereas vets could have just shaved it like this and applied some ointment, when it's that big, we now need to sedate the dog and we need to give cortisone and all sorts of things. So it's really best to get it sorted out as early as possible. And just be aware that it could be something else. And that's really where your value comes in, is to tell the client it could be something else. Maybe you should see the vet. Okay, ear problems are related to skin problems. And that's because the inside of the ear canal is covered in skin. So if we have an itchy allergic dog, we will most likely have itchy infected ears at some point as well. But ear problems can be very complex, and there's many potentiating factors. So what that means is there's many other things that can play a role. So, are the ears upwards? Are they downwards? Are there hairy ear canals? Have they had previous ear problems? Are there mites in the ears? Lots of different things that play a role in managing ear problems. And also we are seeing a lot of antibiotic resistance. So people don't treat the ears properly, and then the bacteria in there become like superbugs, and they're very, very difficult to treat. So again, if somebody comes in and says, my dog's ear's not looking good, and they bring you this photo of this red itchy ear, explain that to them. There may be other things playing a role. Always recommend a vet visit. If the people are reluctant, you can try something like Otosol or Epiotic, Otoaid. There's quite a lot of ear cleaning products on the market that you can give over the counter, but give them the correct expectations. So you go clean the ears. If it's not better within 2 days, that means it's not a simple ear infection, and then they really do need to see the vet to get to the bottom of it. And also just warn the people about the eardrums. So you can see the eardrum is way down there, very difficult to see. So us as vets have to use an otoscope and bend the ear in a certain way to get down there and check the eardrum. But that's one of the things that we do check when they come in. So if this eardrum has been torn, then we don't want to be putting liquids into the ear, and we'll choose other medications. So without having the correct equipment, we won't know what that eardrum looks like, and it can be dangerous to put medication into the ear. So you have to explain that to the clients as well, that we can do more harm than good by taking a shortcut and not getting to the vet with an ear. Right, diarrhea. This is something that you're going to get lots of queries about, and as this little dog is trying to figure out what causes diarrhea, and there's a long list. Anything from parvovirus, IBD is inflammatory bowel disease, so that causes a long-standing chronic diarrhea, cancer, distemper, which is also a virus, pancreatic disease. It could be something that we call garbage disease, which it often is, so where the dogs just eat something that they shouldn't. They could have food allergies, they could have bacterial infections, they could have parasites like Giardia. So it's a very long list. This is just probably the most common things that we see, but it is quite an extensive list. So what you can do, and it's very important, when somebody asks you what to do if the dog has diarrhea, is to ask them if the dog is vomiting. If it's not vomiting and the diarrhea is not bloody or black, then you can recommend something like Diamec, Protexin, Procolon, or one of the other probiotics. Personally, I prefer Diamec, and that's normally what we will give to a simple diarrhea is Diamec. So that is something that you can do. If there is no improvement in 24 hours, or if the dog is vomiting, they need to get to the vet. So again, when are those times that they need to get to the vet? If they're vomiting, if there's blood in the diarrhea, if the diarrhea is black, and if they're really not eating, they need to get to the vet. That's very important. It is tempting in that situation to change the diet. And again, like we've said before, if it's something like an allergy, this has to be done, a diet change or diet trial has to be done under the supervision of a vet. So we'll only use a prescription diet in that point, in that situation. The other things that we would consider changing to would be like ID, which is also a prescription diet. So really all of the diet changes should only be done by the vet. And especially if the person comes in and they say, my dog has had diarrhea on and off for the last 3 or 4 months and I think it's the food, that's exactly the case where you don't recommend a diet trial. They do need to get to the vet. We do need to make sure it's not something serious and give them the right treatment. So we're really looking at Diamec or something like that, something similar. If it's a very simple diarrhea and the dog's still happy and running around, and there's no vomiting, no blood in the stool, then you can give something like that. If it doesn't fit into that small category of cases, they really do need to get to the vet. Okay, vomiting is a completely other scenario. So in this case, it doesn't matter how often or what the vomit looks like or what the dog looks like. If the cat, especially cats, if they are vomiting, they need to be seen by the vet immediately. Don't recommend anything over the counter. Recommend a consultation. Animals can dehydrate very quickly, especially cats and small dogs and puppies. And then we sit with a much bigger problem if they dehydrate, their blood sugar falls, and everything goes a little bit out of whack and becomes a lot more difficult to treat and a lot more expensive to treat. So if they're vomiting, they need to be seen by the vet. And there's a whole long list of things as well that can only be figured out by the vet and by specific tests. So please give them that advice. Right. Constipation is another common problem. So for cats, they may have hairballs, and that is quite common, especially in long-haired cats, and at the change of seasons, so spring and autumn, when they're busy shedding and they're grooming a lot, they can become a bit constipated. So in that case, you can recommend Laxapet or Animalax for 1 to 2 days. And again, if there's not improvement in 1 to 2 days, they need to see the vet. If the cat's not eating or vomiting, they need to see the vet immediately. And if that constipation is going on for longer than 1 to 2 days, then we really, as vets, need to investigate that further. There's normally something else that's causing the cat to be constipated. And we'll do a variety of tests to figure that out and to make the right diagnosis. In dogs, if they're constipated, they always need to be seen by the vet. So they don't have hairballs like cats, and there's almost always something else going on. Sometimes they actually have diarrhea and the people are misinterpreting it, but sometimes they may have eaten a whole lot of bones and they're constipated, or they have arthritis and back problems and they're not passing stool properly. So in the case of a constipated dog, they really need to get to the vet as soon as possible. Another common problem is scooting. So, or in Afrikaans, hulle skier hulle boude. So what those dogs and cats sometimes do, if you've never seen it yourself, is they'll sit on their bums and put their back legs up in the air and drag their bottoms on the floor. And there's really only 2 things that can cause them to do that. So the one is worms, and as we discussed in the previous slideshow, is that worms, especially tapeworms, will actually lay their eggs around the anus and it becomes very itchy and the dogs will then scoot. And the other thing would be anal gland or anal sac issues. So in this picture you can see there's the anus, and that's where the two little anal sacs sit, and they can become blocked, they can become infected, and they can cause the animal quite a lot of discomfort. So if somebody comes into your shop and they say their dog is scooting, you can recommend deworming, and within 2 to 3 days of deworming, the animal should look a lot better. If they're not, they have to go to the vet, and we need to investigate those anal sacs and make sure that they are not causing the problem. If the client can see there's a big swelling in that area, or it's burst open, or there's discharge in that area, you obviously don't wait 2 to 3 days. You get straight to the vet for us to investigate. Right, so incontinence is when the pet leaks urine. We see this more in dogs than in cats, or when the animal is drinking more water, and that we can see in dogs and cats. So those are symptoms that we cannot ignore. These animals always need to be seen by the vet. There's always something else going on, or we need to rule out serious things that may be playing a role. So we're looking at things like hormone responsive incontinence, diabetes, Cushing's disease, bladder infections, pain, kidney failure. All of those things may cause the pet to be incontinent or to drink more water. So there's really nothing you can do over the counter for these pets except explain to the client that there could be something going on. It's extremely important to make that appointment with the vet sooner rather than later. Arthritis is another big thing, and so many of our pets struggle with arthritis, especially our senior pets. So more than half of dogs and cats over the age of 7 will have some arthritis. And that's quite a big number, especially if I look at how many of those senior pets we're seeing regularly and how many of them we've actually got on medication. So it's quite sad that these animals are suffering in silence. And this is something that's very close to my heart because I have a dog myself that has arthritis, and I can see the difference that medication has made for him. And I don't want any patient to suffer in pain. People often don't recognize the signs of pain. So they expect their dog or cat to cry and to moan, but they hardly ever do that. So the only time I've seen a dog or cat cry from pain is when they've had a big traumatic incident, like they've been hit by a car. And even then, very few of them will cry from pain. So that's something to bear in mind. Signs that the pet may be in pain is that they are not walking as far as they could before, or they're getting tired when they go on a walk, if they're not wanting to go up and down stairs anymore, not wanting to play with their toys. For cats, they might start messing outside of the litter tray, or if they were going outside to do their toilets business, they might not do that anymore, and that's because it's just too painful to jump up on that window to get outside. And also aggression, so where you could always cuddle your pet, they now growl at you, or cats will sometimes get very aggressive if they're in pain. They won't let you pick them up anymore. So it can be quite subtle signs, and unfortunately many people attribute those signs to the pet just getting older. Oh, they're getting older and that's why they don't want to go for a walk anymore. But they don't realize that age itself is not a disease, but age leads to diseases. So because they're older, they're more likely to get arthritis, more likely to be in pain, and that's why they don't want to walk. So whilst I as a vet can't make the pet younger, I can treat the diseases that come with age. So this is so important. If that person comes in and says, he's just not walking so much anymore, I wonder if I could just get a supplement to make him feel better. Sorry about the barking in the background. So it's really important to make sure that when somebody comes into your shop and says they want to supplement, their dogs seem to be getting a bit creaky or not as happy as they used to be, to explain that those signs are the biggest signs that you'll get for a pet that's in pain. And whilst we can sometimes supplement them and help them a little bit, in many cases they really need medication. And so they need a consultation. Oftentimes we need to take x-rays and see what's going on, because it can be other things as well that cause pain. So it's very dangerous to just assume that they're a little bit old and they need a supplement. No animal deserves to be in pain, and they really deserve to be seen by a vet. And this is one of the reasons why we recommend senior pets to be seen by the vet every year, because what we do is we check every joint and we ask those questions. Are they not jumping onto the counter anymore to eat their food? Are they messing outside the litter tray? And then the clients will say, yes, yeah, actually I did notice that. And then we'll pick up that the animal's in pain and we can treat them for it. So my take home about arthritis is no animal deserves to be in pain. And this is another one of those amazing opportunities that you have to make a big difference for these pets. I do know that there are clients that won't want to go see the vet, and we understand that. And we know that there are breeds that are predisposed to getting arthritis. So we know our large breed dogs and our large breed cats, like Maine Coons, are more likely to get arthritis. So in those cases, you can recommend something like Arthro-Focus. So we know that there is a good chance that they might develop it in the future. And so let's start them as a puppy on that supplement. That's a great idea. And then as they get more advanced in age and they do have arthritis, something like R3 joint or GCS dog will help with the management of the disease, but they will most likely still need medication. It's also very important to realize that there are so many supplements on the market, and for the human market as well, and a lot of them have chondroitin and glucosamine, and we're not too sure if those really help so much. What we do know absolutely helps is omega-3s, and that's why I particularly like the GCS dog range. They've got quite high levels of omega-3, and then your Hill's JD food is probably the best thing to, or supplement in a sense, to give a dog with arthritis, but once again, that's a veterinary prescription food. So you'll see this kind of trend through this presentation. If the client is noticing something with their pet, they really need to get them to the vet. Right. I just want to chat about recommending medication. So right at the beginning we said that only vets may prescribe medication. It's quite tempting. Sometimes people really do push you and want information and they want shortcuts. So you cannot recommend that they give them any medication. Even medication they may have left over from another pet, you cannot recommend that. That has to be done by a vet. And especially we don't want to be recommending Panado or Disprin, and especially not to cats. So a quarter of a Panado can kill a cat in 2 days. So we really, really don't want to be giving people that sort of advice. It has to be done by a vet. Another common thing that people will come to chat to you about is wounds. And many, many wounds can be managed at home without seeing a vet. So if they're small, superficial wounds, so if you can see it's just going through the top layer of the skin, and they're about less than 2 centimeters, somewhere on the body wall, they could clean it with a little bit of salt water at home, or F10 is even better, and F10 ointment can be applied to that area. We don't want them to be using Savlon or Dettol, especially in cats, so that can cause a major allergic reaction in cats. So if they don't have any disinfectants, they can really just use warm water, or warm, slightly soapy water will do the job. So if it's one of those small superficial wounds, what you would normally do with yourself for home is fine, and an ointment like Bactroban is also fine if that's what they've got at home. If it's a larger wound, so anything more than 2 centimeters, or it's on the face or on their legs, or if it's as a result of a cat fight, those wounds need to be seen by the vet. And the sooner they get to us, the cheaper it's going to be too. So you might wonder why I've got a picture of an iceberg about wounds. And what often happens with dogs and cats, because they've got loose skin, especially in a bite wound, you'll only see this tiny little wound on top, but the other dog or cat will have possibly ripped the skin underneath, or especially in dog bite, they shake the dog when they bite, and that really makes this huge big pocket underneath the skin, which you can't always see. And also there's often hair covering that area, so you can't always see exactly how big the wound is. So especially in the case of a dog bite, you might come in and we just see 2 little holes, and then we go shave that area and we've got a huge big problem. And it's much easier to treat the dog on the day that they get bitten, when it's just these 2 little holes, and we shave it and clean it, and we give them some antibiotics and everything's fine. Then 3 days later, where we've got a big abscess or a big infection and a huge area that's affected. So this is really one of those cases, if it's bigger than 2 centimeters and it's a deep wound, we want to see them at the vet. And if we see them on that first day, it's probably not going to be so expensive. If we see them 3 or 5 days later, that could be a lot more expensive, a lot more complicated, and it's also not nice for the pet to sit with this huge wound that starts festering over a few days. It's painful for them, so we really want to see these patients earlier. Just want to chat quickly about behavior, and a lot of people will come talk to you about their new puppies and they're so excited, and you're their first point of contact. So this is an awesome time to chat to them about important things. So 2 big things that are really important to highlight for them would be their vaccinations. So again, they need to get to the vet at least 3 times when they're a puppy, and puppy school. So the window for puppy school is from about 10 to 12 weeks. We really want to start getting them into puppy school, and that's because dogs have what we call a socialization period, and that's when they learn what is acceptable as a dog and how to behave with other dogs, and how people behave, and how it's appropriate for them to behave with people. And from about 12 to 14 weeks of age, we get the onset of fear. And so before that, you'll notice young puppies will come running up to you regardless of what you look like and what you do, and they'll love you and they'll think you're amazing. But after 12 to 14 weeks, they start becoming fearful of the world. And then it becomes difficult to teach them these things. They become fearful as part of instinct and survival. That would be the stage where their moms in the wild would let them come out of the den and experience the world. So that it's important that they do become a bit fearful in order that they survive. But in our setup, where they're domestic dogs, we want them to learn how to behave, and the window period is 10 to 12 weeks. So when people come in at 8 weeks and say, I've just got a new puppy, you need to tell them then and there to enroll the puppy in puppy school. And that makes such a difference for that dog's whole life and for how the dog fits into the family. So that's critical. It's also an opportunity to speak about house training. And there's lots of old wives' tales and things about house training. And this will also be covered in puppy school. So that's another reason for them to go to puppy school. But it's important to chat to them a little bit about house training and what to do. So the key thing to do with house training is to make sure you're consistent, and that you take the puppy out when they are likely to need to go out. So that would be after they've woken up, after they've eaten, after they've played, and at least every hour. So if you haven't taken your puppy out in 2 hours, it's time to get them outside. And at night, in the beginning, it's a good idea to take them outside before you go to bed, and then even set an alarm somewhere here 1, 2 o'clock in the morning to take them out then, and that way you prevent accidents. So you want to really set these puppies up for success. It doesn't help by punishing them when they make an accident in the house. You really need to give them the opportunity to do the right thing, and that's by taking them out frequently. Bear in mind, when you do take them outside, it's a new environment and it's exciting, so they're going to sniff around and forget that they needed to go to the toilet. So give them a few minutes to settle down, and then when they do make a wee or a poo, you need to be super excited about what they did and reward them and give them hugs and kisses, and use your best squeaky puppy voice to tell them that they did a really good job. And they'll start realizing that every time I go outside and I do this, amazing things happen to me, and they'll start developing the skill to go out on their own. It's also important to just watch for those behaviors. So if they start sniffing around and sort of almost walking in circles and sniffing, then you know that it's time to take them outside and see if they need to go to the toilet. What we really don't want to be doing is rubbing their noses in an accident, hitting them with a newspaper, punishing them and separating them from the family if they make an accident. That's not appropriate. We need to set them up for success and reward them when they get it right. Bite inhibition is also something that's quite important to talk about. So what that means is we teach them how hard they can bite. We've also got that window period in which to do it, and I think that's why puppies were made with super sharp teeth, because it's almost instinctual that we don't want them to bite hard when the teeth are so sharp. So it's something that happens almost automatically. But if we can teach them the skill of how hard they are allowed to bite, that does make them a safer dog, because they have inhibitions just like us. Socially we know we can go up to that point and we can't go any further, and that helps with aggression and things down the line. So what you do there is you actually rile the puppy up a little bit, so you play rough and tumble like they love to do, and then they often start biting your hand. And if they bite too hard, then you can make a growly sound or a cry sound and move away from the puppy for a minute or two. And they very soon learn that if I bite that hard, the game stops and all the fun stops. And you do that a couple of times over and over for 5 or 10 minutes, and then a few times throughout the day. And you'll very soon see in a week or two that they learn how hard they can bite. It also helps to transfer that behavior to something else. So you can rile them up and then have a rope or something like that they can also play with, and just transfer that bite onto something that's not a human or another dog. And that's very helpful. If you have other dogs in the household, they'll also teach the puppy that to some extent, and you can watch them. The puppy will play and they'll tolerate it to a point, and then the puppy will bite them too hard and they'll get up and walk away. So we really want to mimic those behaviors that dogs would normally do to teach them the skills that they need to live in our families. And all of these things are also taught in puppy school, so that's why it's really important for them to do that. The last thing that's taught in puppy school is coping with separation, and that's separation anxiety is something we see quite a lot in dogs. And if we can lay the foundation as puppies, we're less likely to struggle with that as they're older. So it's very important when they are puppies to let them be on their own for short times. And they realize then that firstly they can survive it on their own, and secondly the people will always come back. So in the beginning you want to do 1 or 2 minutes at a time where they're in another room or outside by themselves, and you slowly build that up to where they can be by themselves for a few hours. And that's very important to be able to do that. Just bear in mind, if there are older dogs, that it's not always best to leave the puppy with the older dog unsupervised. You'll have to see how they interact. So those are some skills that you can discuss with clients, and things that we discuss when they come in for their vaccinations as well. So we really have, in the EBVET group, we have an outlook of trying to prevent things, trying to make that dog, or let that dog live their best life. And it starts in that puppy phase and laying the right foundations. All right, so you may have somebody come in with a query with an adult dog that maybe didn't have those foundations laid, and now they're struggling with behavior problems. Firstly, we don't want to make them feel guilty. This happens to the best of us. So despite me maybe knowing all these things, I've had a dog with separation anxiety, I've got a dog that is aggressive and territorial, and I also had a dog that had noise phobia. So it can really happen to anyone, but it's great to have the tools to help people. So the 3 big things that we see with regards to behavior would be noise-related anxiety or separation-related anxiety. So people will often say, it's thunder, my dog hides away, it shivers, it looks terrible, it looks frightened. Or if the other option would be, or other scenario would be, if I go out, my neighbors are complaining, my dog's barking and howling, or they're incredibly destructive. When you come home, your garden is trashed or your house is trashed. So it's important to realize that this is a mental disease for these dogs. And just like in people, we know people have anxiety and depression and things like that. And people are mammals, and so are dogs, and they can have the same sorts of problems. And it's like any other disease, it can cause suffering in that dog. So we need to be cautious with what we say and be sure that we try and get the dogs the help that they need. So if it's anxiety related to noise or separation and it's fairly mild, you can try something like Calmies or the other products that are available over the counter. But warn the client it might not work, especially if the dog is severely anxious. It might not work, but give them the hope that they need. So don't just send them away with no answer. Say to them, if this doesn't work, the vet has got a whole arsenal of drugs to help you. And then the next step would be to visit the vet, where we do a full examination. We often recommend quite strong medication, antidepressants and anti-anxiety medication. And then we often get a behaviorist on board to help the dogs with that anxiety as well. So that's quite important to tell them that. If they struggle with traveling, so they can either become very anxious when traveling, or if the clients are immigrating or moving far away and they have to have a long drive or a flight, they might not know if the dog will be able to cope with that. So you can try something like Calmies or Good Behavior Collar or Adaptil as well. Adaptil is probably the better collar to try for traveling. If they know that they've tried that and it doesn't work, there is stronger medication available as well. But that, again, is highly scheduled medication. They need to see the vet for that. And if they have car sickness as well, then they need specific medication on prescription from the vet. So there is hope for those pets, and there is the things that we can do to help them, but it's not always available over the counter. And then with regards to aggression, this is obviously a very serious thing to deal with, and we need to give them the right advice from the beginning. So it could be aggression between dogs, or it could be aggression related to people. And you don't have to be a rocket scientist to know that that could have serious consequences. So the first step, if they say their dog's aggressive, what can I do? Can I get a shock collar? Or, people come in with all sorts of things that they've Googled. The first thing that they need to do is get their pet to the vet. So we know one of the big causes of aggression, especially sudden onset aggression, is pain. So we need to check that those dogs are not in pain and treat it appropriately and make sure there's nothing else going on. Some medications can cause aggression. Some diseases can cause aggression. So we need to check that out. And once we've dealt with that, the next step is to go to a behaviorist to assess the dog and equip the clients with the right tools. So that's something we don't mess around with. What you can do to recommend as a safety is also just try to separate that dog from any other dogs or people, that the people can control the situation to prevent a serious outcome until they can get to the vet. But that's something we take very seriously, and we can't just treat that over the counter. Great, so cat behavior is a lot more complex than dog behavior, and part of that is because they are quite subtle in what they show, and they're very misunderstood, and we're still learning about them often and learning new things about them, and it's quite difficult to sometimes know exactly what a cat is thinking or how they will behave. So this is really an opportunity to chat to people about their cats and highlight things to them and try and make sure that people recognize the subtle signs that their cats are showing them in order to get them the right help. So before we go through the list, first of all, if somebody does notice a behavior change in the cat, it could be the only clue we have to an underlying issue. So they should not ignore that. They should chat to their vet. They should see the vet with their cat, because something very, very subtle can really be the only clue that we have, and that's important for us to investigate. So at the top of the list, spraying or inappropriate urination. This is probably one of the most common behavior problems we see in cats, and it could be anything from just urinating in the wrong place, so on somebody's bed or on visitors' clothes or on the couch or wherever, so it will definitely be noticed by the client. It's not something we want to see. Or it could be so subtle as just missing the litter tray, or not going all the way outside, things like that. Or it could be spraying, and that's where we see them actually going up against a vertical surface, a wall or a door frame, and they spray up against there. So for me, this is a cat screaming for help. If a cat urinates in a place that is not appropriate, so not in a litter tray, not outside, it is screaming for help, and it has to be seen by the vet. And it could have a medical problem like bloodstones or bladder infection, kidney disease, arthritis, or it could have a behavior problem, and these cats are severely stressed, and that's why they're doing what they're doing. And in many times it's got a component of both. So there's really no reason to not recommend them going to the vet, and they need to go as soon as possible. I can't reiterate that enough. They really, really need to be seen by the vet. So this is not a time to sell them get off crystals and this and that and all sorts of things and cleaners and all of that. That's not going to help. The cat is screaming for help. It needs to be seen. What you can advise, though, to help the clients deal with the smell in their house is to wash the areas with warm water and washing powder. So washing powder breaks down the proteins in the urine, which gives it that terrible smell, and they can deal with it that way, but that's just really treating the surface. They need to get the cat to the vet. In the case of aggression, in any form, so aggression between cats or aggression towards people, one of the big reasons for that would be pain. So that again might be the only symptom clients will see, and they need to get their pet to the vet, or their cat to the vet, that we can check that out. People often ask for advice about moving house and how to deal with their pets, and this can be tricky, especially in cats. And we know cats can walk very far distances to get back to their home territory, and they are territorial animals in general. So the first thing I would recommend if people are moving house with their cats is to get the cat microchipped. Even if they plan to keep the cat indoors, this is one of the times that cats will often try and escape and get lost. So that will help quite a lot. And then keeping them indoors for the first week or two so they can get used to their home as their home territory, and then supervising visits outside for a week or two as well, that they can familiarize themselves with their garden and where their new home is. If the cat is stressful or anxious, you can use a Feliway product, so either the diffuser or the spray in the new house. You can use that in the old house as well while you're busy moving, because the cats get very unsettled. When you're packing the boxes and the house looks very different, that can already start them feeling stressed. So that can help as well. And then also making sure you have a safe space for them. So I would start that in the old house already, and they probably have their favorite spot and have a little bed and their scratch post and things there, and make sure you transfer that to the new house, that they have a safe space that they can hide out. But this can be very stressful for cats, and it can lead to our first problem of spraying and inappropriate urination as well. So that's important to bear in mind. If you're introducing new animals, keep it safe, and especially with cats. If you bring a new cat into the household, because they are extremely territorial, that can create big issues for your cat and can cause a lot of stress in them. So go really slowly. It can take a month or two for the cats to get used to each other, and you want to introduce them in a safe, controlled manner. And it's often best to chat to your vet or to a behaviorist before you do that, to get advice on how to do that properly. And again, just be on the alert for signs of spraying or inappropriate urination, because that is a stressful life event for a cat. Right, nail clipping is something people might ask you advice for as well. So in this diagram you can see kind of a cut through picture of the nail, and the grey bit is what we call the quick, so that's the life of the nail. The first little bit up to about there is actually bone, so it's like the last digit, the last little section of your finger, and then you've got a bit of life there. So if you cut too deeply, you can cut into that quick, and it's extremely painful for the dog, and it can bleed terribly. So just to be aware of that. If clients do want to combine nail clippers, these are the best type. I've found the easiest to work with. The guillotine type nail clippers are quite tricky to work with sometimes, especially if the dog or cat is not tolerant of nail clipping in general. If you are lucky enough to have a dog or cat with white nails, you can see quite easily that there's the quick, that pink area, and then you want to leave about 2 millimeters and cut just through the white area. In some dogs though, it can be a bit misleading, so you always start a little bit more conservatively and then look at the nail, and you can see if the quick is starting, there's a little pink area, then you know you can't go too much shorter than that. If they have black nails, another guideline is to look at the bottom of the pad and then cut at that level. So you don't want to cut shorter than the pad. That's quite important. And also when you cut, you want to cut parallel like they've cut there. You don't want to cut at an angle up like that, because then you're likely to hit the quick. And you also change the direction in which the nail grows so it doesn't weigh down easily. So that would be your guideline there. And in cats, you most often can see the quick, and they have this sharp point that we want to get rid of. So they're fairly easy to see where to cut, but not always easy to cut because they don't always tolerate it very well. So those are the guidelines for cutting. Sometimes, even if we have the best intentions, they will bleed quite a lot. So what to do if they bleed, it's good to be prepared beforehand if you're going to cut your dog's nails at home. So to have something like Stahl dripples or potassium permanganate, which you can get at a pharmacy, and then you just apply it to the area that is bleeding. Otherwise, you put pressure on that area. So you have some cotton wool, and you're going to have to stand there for a few minutes for the bleeding to stop. So those are the guidelines for nail clipping. If the client is struggling with nail clipping, there's no reason to struggle at home. So we have grooming parlors in our group, we have vets in our group, we have nurses in our group, and they are welcome to book an appointment with us, and we can assist them with that. And in some cases, if a dog or cat has had really bad experience with nail clipping before, or they're a breed that has very thick nails like Bassets and Great Danes, it's very painful to cut those nails. No matter what you do, then in those cases we often have to sedate the animal to do that. So if they're struggling, recommend that they make an appointment with one of the vets. Alright, so remember, you've probably noticed quite a theme throughout this presentation of if there's a problem, get to the vet. And that really is often the quickest, cheapest way to resolve the problem, is to get a diagnosis and treat it appropriately. It's the least frustrating for the client because they get a solution quickly. It's often the best for the animals' well-being, that they don't suffer with something for a long time, and it makes our job as vets the easiest. It's horrible to have a case where if I'd seen that animal 3 or 4 days ago, I could have saved its life, or I could have treated it for 400-500 rand, but now it's in very bad shape and it's going to cost thousands, and the prognosis is poor, and we may need to put that animal down. That's heartbreaking, and that's why it's so critical for you, where you are in the front line and you can really, you've got a golden opportunity to give advice for that patient, to give them the right advice. So please do that. And if you are not sure of what to say, then always recommend going to a vet. You can't go wrong with that. Or recommend they at least phone and get some advice. And then remember, the only person that's qualified to make a diagnosis is a vet. So watch your language. Don't diagnose something inadvertently. Always say it could be this or that, or there are lots of things that it could be, but only a vet can make that diagnosis. And trial and error treatment increases costs and delays the pet getting the appropriate treatment. So we don't want to try this, try that, try that. We really want to know what it is and deal with it and sort it out. Great, so be sure to watch the next video, which is going to cover emergencies and tips to advise clients on those. That's going to be more aimed at reception staff when people are phoning in with emergencies, but it is useful just as a pet owner to know what to do in those situations. Thank you so much, and don't forget to ask your questions, and also go back and watch parts of the PowerPoint again if there's something that comes up or you're not sure about it. I hope that was helpful to you, and please let us know if there's anything else you need to know. Thank you.